Hello, everyone, and welcome. This is Nurse Eunice with Florida Training Academy, and in today's video, we're going to be talking about the HESI exam. If you're preparing for your nursing, if you're preparing for nursing school, if you're interested in learning more about the requirements in order to apply, I want you to tune into this video, and we'll get started in about 10 seconds. Welcome, everybody. Hello, Yami. All right, so first let's talk about what is the HESI. And HESI stands for Health Education Systems Incorporated, and A2 stands for the admission assessment. So we call it HESI A2. And the HESI is actually part of the nursing application process. Many nursing schools throughout North America use the HESI A2 as an entrance exam. So the better you prepare, the more you study, the more likely you are to have a higher score and hopefully get accepted into those competitive nursing programs. And each school gets to determine how many questions are on their actual HESI exam, but the national exam has 326 questions, and it can take up to 4 hours to complete the exam, depending on the actual nursing program that you apply to. So whenever you're interested in going to nursing school, that's one of the questions you want to ask. Hey, is there an entrance exam? And if so, how do I get study resources for that particular test? All right, and so for the HESI itself, there are 8 main components that make up the full exam, and the schools can choose which ones they want you to take. Mathematics, reading comprehension, vocabulary, grammar, biology, anatomy and physiology, and also physics. And so whenever you purchase your study manuals or get your study guides from your schools, you want to study on those topics that you are least familiar with. And for some of you all, you may have to study for a few weeks, and that's okay, because I'd rather you take your time and study and go back and cover some of those topics you haven't reviewed in a while versus you go off and rush and you take this HESI exam and you don't do well and you don't get selected into that nursing program. All right, and so whenever you have opportunity, you can go back and replay this video. I'm just going to go through this really quickly. Your HESI A2 exam outline. There's 55 mathematic questions, 50 questions on reading comprehension, and then the breakdown is shown beneath each of the topics. We have 50 questions on vocabulary, 50 questions on grammar. Look at this super CNA, super nursing student. 30 questions on biology, 30 questions on chemistry. Anatomy and physiology, we have 30 questions. Physics, 25 questions. And again, your nursing program can require you to take questions from each of those topics, or it may only select maybe 6 of the 8. So ask those questions when you're going to tour those campuses. All right, and so there is no official passing or failing score for the HESI. However, each nursing school sets its own standards, and generally speaking, if you score below a 75%, that's an indication that you are not ready for the challenges of nursing school. So I need you to get your study habits right and keep on studying. Don't give up. You can take the HESI again. All right, and in most cases, the nursing school or program you're applying to will handle the actual administration of the HESI exam. So you're not going off to a secondary testing site like you do for CNAs. You take the HESI exam at the nursing school. They'll determine what fees you pay, and you most of the time can do it right there on that same college campus. So become familiar, go speak to the career advisors, because I want you all to go from CNAs to nurses, and I hope that this video encourages you to do so. All right, let's see how well we do. So making a great score on the HESI can make a huge difference in helping you secure that admission into the nursing program. And now we're going to start with our test. All right, so here we go, everybody. Which of the following is not a function of the respiratory system? Regulation of blood pH, production of urine, exchange of oxygen and carbon dioxide, or regulation of breathing rate. So we're preparing you for that nursing entrance exam. Which of these is not a function of the respiratory system? And hi, Niyu Love. Hey, Paula. Hey, Karen. Hey, Tamika. Yes, yes, yes. The correct answer is B, so the respiratory system is not involved in the production of urine. Its main function includes gas exchange, that's the oxygen we breathe in, and the carbon dioxide that we exhale, regulation of blood pH through the elimination of carbon dioxide, and regulation of breathing. So that would be the purpose of your respiratory system. Let's go to question number 2. Which organ is primarily responsible for detoxifying the body and metabolizing drugs? Is it A, liver, B, kidneys, C, pancreas, or D, spleen? Hi, Amy. Hi, Jean. Hey, Janvier. Detoxifying the body. Nikisha, close. Javier, close. Karen, I think you have it. You all, it is the liver. A lot of your medications are actually metabolized by the liver. So if someone has liver failure, oh, they're going to become toxic. So the liver plays a crucial role in detoxifying the body by metabolizing drugs, breaking down toxins, and filtering the blood. Okay, great job, team. And if you're not taking notes, I recommend that you do so. And of course, you can always go back and watch this video later. And if you weren't here for the introduction, this video is to encourage you to begin studying for the nursing entrance examination. And if you do well on this test, I know you'll do well if you continue your studies so that you'll get a higher ranking and get accepted into those nursing programs. So question number 3, which of the following is a symptom of hypoglycemia? A, increased thirst, B, excessive sweating, C, weight gain, or D, increased heart rate? Sign or symptom of hypo being low, glycemia, the sugar within the bloodstream. All right, Jean says B, Tamika says B. Amy, we do have a caregiver program here, but we're in Jacksonville. It's our CNA exam prep program. You all, if someone has hypoglycemia, they're going to be experiencing B, excessive sweating. So hypoglycemia or low blood sugar can cause symptoms such as excessive sweating, confusion, weakness, and trembling. Oh, here we go. Question number 4. What is the primary function of the kidneys? A, regulation of blood pressure. B, production of red blood cells. C, regulation of blood glucose levels. D, filtration of blood and urine production. Hi, Jerlene. I think I see one correct answer so far. Yes, everybody. Yes, great job. You know the role of the kidneys. The kidneys filter. So they filter waste products and they help to maintain fluid and electrolyte balance. Question number 5. Which of the following is a characteristic of type 2 diabetes? A, insulin resistance. B, destruction of pancreatic beta cells. C, rapid onset of symptoms. Or D, autoimmune response. When someone has type 2 diabetes, what's a characteristic of their condition? This one's a little tricky. I see the correct answers, everybody. It is A. So with type 2 or adult onset diabetes, it's characterized by insulin resistance. And that's when they'll usually have to give their own insulin injections because the body doesn't respond properly to the insulin that it's making. And it's going to, if it's making any insulin at all, and it's going to lead to high blood sugar levels. So type 2 diabetes, those are usually going to be your insulin dependent diabetics. Question number 6. Which of the following is an example of a non-renewable energy resource? A, solar power. B, wind energy. C, fossil fuels. Or D, hydroelectric power? Which of these is non-renewable? Once you use it, it's not coming back in your lifetime. I don't see the correct answer yet. So this is why when you get your study guides for the HESI, remember, it's just not about medical terms. It's going to talk about biology and science. So I need you to study it because the correct answer for this one is Fossil fuels. Yes, Genevieve. Fossil fuels such as coal, oil, and natural gas are non-renewable resources because they cannot be replenished on a human time scale. The other one, wind, water, those are usually renewable resources. Number 7, what is the function of the cerebellum? A, regulation of body temperature. B, coordination of muscle movements. C, production of hormones. Or D, regulation of hunger and satiety. So now you got to figure out what the cerebellum is. And it's really close to the word cerebrum. So that should help you. It's in the brain. So what does this organ do? Paula, Nikisha, Niyu, let's see. Yes, thumbs up. Hold up, I want you to see this. Great job. Coordination of muscle movement. So the cerebellum, which is Latin for little brain, is a major structure of the hindbrain that is located near the brain stem. The cerebellum is responsible for coordination of voluntary movements, maintaining balance, and posture. So proud of you all. Number 8, which of the following is a risk factor for cardiovascular disease? A, regular physical activity. B, high fiber diet. C, smoking. Or D, normal blood pressure. Which is a risk factor? All right, I'm revealing the answer in 3, 2, and smoking. Yes, John Vier, smoking. So risk factors would include like a high salt diet or eating a whole bunch of processed foods. It'll be a sedentary lifestyle. So risk factors are things that can sometimes be changed with environmental or just changing your habits. So smoking is a major risk factor for cardiovascular disease as it damages blood vessels, increases blood pressure, and increases to the buildup of plaque in the arteries. So if you want to improve your heart health, stop smoking. Number 9, what is the purpose of the lymphatic system? A, regulation of blood sugar levels. B, transportation of oxygen to temperatures. C, defense against infection and disease. Or D, digestion of food. The lymphatic system. When you say, oh, I feel like my lymph nodes are swollen, what are you thinking could be happening to you? And if you said, I possibly have an infection, you are correct because the lymphatic system has a defense against infection and disease. And so it plays a key role in the body's immune response by filtering and removing toxins, waste, and other unwanted materials from the bloodstream. I saw a lot of you get that answer correct, so I'm proud of you. Question number 10. Which of the following is a symptom of a urinary tract infection or a UTI? Rash, headache, dysuria, or painful urination, increased appetite. Which of the following? And for this one, it's not A. It wouldn't be a rash. When you initially, the rash comes if the skin is wet. So the rash would be like a symptom of urinary incontinence, not a urinary tract infection. So for you all, it's not A, the correct response. And I see a lot of answers there. It's C. It is dysuria. DYS means difficulty or pain. Uria, referring to urine. So dysuria is a common symptom of a urinary tract infection, along with frequent urination, cloudy or bloody urine, and a strong urge to urinate. Hey, Tabby. 11. What is the normal range for a blood pressure in adults? A, 90 over 60, B, 120 over 80, C, 140 over 90, or D, 160 over 100. Oh, I'm seeing answers all over the board, but yes, it is a B as in boy. So the rationale, 120 over 80 is considered a normal or a healthy blood pressure. The top number, 120, is your systolic number. So that is the pressure whenever the heart pumps the blood. That's the force that the heart needs in order to circulate the blood throughout the body. The bottom number, or the diastolic number, which is 80, is whenever the heart rests and it refills with blood. So those numbers do have meaning and they have importance. But most of the time in your facilities, your nurse is simply going to ask you, hey, what's the systolic blood pressure? And so you just tell her the top number if she did ask that. But your facilities, especially when you're preparing for nursing school, they may say that the normal systolic is not 100 to 140. They may say the normal is 100 to 130, and that you're pre-hypertensive whenever you get to like a systolic of 130. So for my purposes today, systolic is 100 to 140, diastolic is 50 to 80. But when you're in nursing school, you go by your textbooks so that you can pass your test. And I don't want you being mad at Nurse Eunice. All right, let's go to our next one. Number 12, which of the following is a function of the integumentary system? A, regulation of body temperature. B, production of hormones. C, synthesis of vitamin D. Or D, regulation of blood sugar. So integumentary system, your skin, those different layers, what does it do? I think I see one correct answer so far. Yes, and I think it was Karen and Niyu and Tamika. Yes, think about when you sweat. So the integumentary system, which includes your skin, hair, nails, help to regulate body temperature through processes such as sweating and shivering. Hey, we're preparing you all for nursing school because I need new, fresh nurses who want to take care of people, who want to work as a team. And so if you're interested in learning more about the entrance exam, and one of which is called the HESI, I do have the bundle that is available on nurseeunice.com. But you can also, whatever nursing school that you plan on going to, you can just ask them, be like, hey, what free resources do you have so I can prepare for the HESI exam? And most schools will be happy to give you some free resources. All right, question 13. What is the purpose of the endocrine system? A, regulation of body temperature. B, coordination of voluntary movements. C, production of hormones. Or D, digestion of food. The endocrine system. Joanna, magical touch salon god, I'm so happy you're interested in being a nurse. You make my heart smile. And so you all, I see the right answer. It is C. All right, so C, the endocrine system is responsible for producing and secreting hormones that regulate various physiological processes, including metabolism, growth and development, and the reproduction functions. And so whenever someone is low on hormones, let's say a woman who's experiencing menopause, so yes, the endocrine system is very important. Testosterone, progesterone, also don't forget about insulin. So if their hormones are out of whack, then of course their body is going to be functioning differently. Number 14, which of the following is a characteristic of chronic obstructive pulmonary disease? Is it reversible airflow obstruction, decreased lung compliance, C, normal lung function test, or D, rapid onset of symptoms? Which is characteristic of COPD? Think of those patients who are having respiratory problems. I don't see it yet. I don't see the correct answer yet. But yes, Tamika, Jasmine, yes, it is B, decreased lung compliance. So COPD is characterized by what we just stated, decreased lung compliance, airflow limitation, and symptoms such as coughing, wheezing, and shortness of breath. And we talked about different things such as smoking previously, how smoking affects your cardiovascular health, but smoking also affects your pulmonary system, your respiratory health. And so here we have an image of healthy lungs, and we also have an image of smokers' lungs, because sometimes smokers can develop COPD. You'd be like, oh, you have that smoker's cough. That's what we're referring to, because their lungs are damaged. Number 15, what is the primary function of the gallbladder? A, production of bile. Read this one carefully. B, storage and concentration of bile. C, absorption of nutrients. Or D, regulation of blood glucose levels. Everyone got this right. It is B. And so storage so the gallbladder stores and concentrates bile produced by the liver, releasing it into the small intestine to aid in the digestion of fats. And so the glowing organ there that's behind the liver, that simulates where the gallbladder is located. Question number 16, which of the following is a symptom of hypothyroidism? We talked about the prefix hypo, that means low. Thyroidism, where's the thyroid located? All right, so is it A, weight loss, B, heat intolerance, C, fatigue, or increased heart rate? When someone says, oh, I have hypothyroidism, I have my thyroid gland isn't working properly. Yes, Natasha, yes, Claudia, it is going to be C. So hypothyroidism or underactive thyroid can cause symptoms such as fatigue, weight gain, cold intolerance, dry skin, their hair becomes brittle, and constipation. And so whenever someone starts having these symptoms, they'll go to the doctor, they'll run a panel of tests, and that's when we'll usually find out that their thyroid level is low. It is underactive. And the image there, kind of like the butterfly that's wrapped around the trachea, that would be the actual thyroid. What is the purpose of the spleen? A, production of red blood cells. B, regulation of blood glucose levels. C, removal of old or damaged red blood cells. Or D, regulation of the body temperature. And for those of you who are just tuning in, remember that for the HESI or the nursing entrance examination, you have to know anatomy and physiology. So this is going to just hopefully prompt you to learn more so that you can be successful during your HESI or your nurse entrance exams. And I see B, I see A, I see C. Let's see what the answer is. The answer is C. The spleen is a small organ that acts as a blood filter, removing old or damaged red blood cells and storing platelets. And if you can see there to the image, on the image, the spleen is near the actual stomach. Question 18, which of the following is a risk factor for osteoporosis? A, high calcium intake. B, regular weight-bearing exercise. C, increased estrogen levels. Or D, smoking. Revealing the answer in 3, 2. This one was tricky. Claudia, you got it. It is D, smoking. So smoking is a risk factor for osteoporosis as it can interfere with calcium absorption and reduce bone density. So if I haven't learned anything else during this anatomy and physiology, this HESI review, it's pretty much don't smoke. Smoking causes too many health-related conditions. Number 19, what is the function of insulin? A, regulation of blood glucose levels. B, promotion of inflammation. C, regulation of blood pressure. Or D, production of bile. What does insulin do? Paula, Nia, Marcia, you all have it. That one was easy for you all. It's the regulation of blood glucose. So insulin is a hormone produced by the pancreas that helps blood glucose levels by promoting the uptake of glucose into the cells for energy storage. All right, number 20, which of the following is a function of the skeletal system? So the skeletal system has many functions, but which of these is one of those? Is it A, regulation of body temperature, B, protection of internal organs, C, production of hormones, or D, regulation of blood pressure? Oh, you all didn't give me time to even read it. Nikisha, Tamika, Farida, Marsha. I think Marsha has it. Yes, Marsha, Karen. Think about that rib cage. So the skeletal system provides a structural support for the body and protects internal organs from injury. That is one of its functions. So if you chose B, great job. Question 21. Which of the following is a symptom of myo? When you see the prefix MYO, it's related to the muscle. Myocardial infarction. Infarction means death. So which of the following is a symptom of your heart muscle dying? And yes, Nikisha, Tamika, it is B. When there's a blockage, the person may experience chest pain or discomfort, and that is a symptom of myocardial infarction or a heart attack. Yes, Vilma. Number 22. What is the function of the pancreas? This one should be easy. I think we already gave you the answer. A, production of insulin and glucagon. B, regulation of blood pressure. C, removal of toxins from the bloodstream. D, regulation of body temperature. Pancreas, pancreas, pancreas. I'm not seeing the right answer yet. Revealing the answer in 3, 2, and I think I just saw it. All right. So yes, it is. So you all, the pancreas has multiple parts, and this image here is not the best image, but it's the one I found. So the pancreas produces insulin and glucagon, hormones that regulate blood glucose levels and metabolism. And the pancreas has multiple parts. It has the head, the neck, the body, and the tail, but it also has ducts too. So whenever you're studying your anatomy and physiology, make sure you study the organs and all the glands also. 23. Which of the following is a function of the nervous system? A, regulation of body temperature. B, production of red blood cells. C, coordination of voluntary movements. Or D, regulation of blood glucose levels. The nervous system. What is the function? You have to see me doing my nursing dance because you all are choosing the right answer. And the correct response is C. Great job, team. So coordination of voluntary movements. The nervous system controls voluntary and involuntary movements, sensory perception, and cognitive functions. 24. Which of the following is a characteristic of asthma? A, reversible airflow obstruction. B, decreased lung compliance. C, normal pulmonary function test. Or D, rapid onset of symptoms. Now think about it. Asthma. What is a characteristic? Why do they have to use their inhaler? I see the answer. I see the answer. Yes, it is A, reversible airflow obstruction. So with the airway inflammation and the symptoms such as wheezing, coughing, and shortness of breath, they're not able to get enough air. So we actually give them albuterol or some type of inhaled medication to open up those blocked passages, those blocked airways. 25, and I'm going to let you all know now that I'm going to miss you all because we're on our last question, and I know I hate it. I only do 25 questions at a time, but 25, what is the primary function of the cardiovascular system? A, regulation of body temperature. B, transport of oxygen, nutrients, and waste products. C, production of hormones. Or D, regulation of blood glucose levels. Oh, even though you got the answer right, I'm sad because we've reached the end of our test. You all, the answer is B, transport of oxygen, nutrients, and waste products. So the cardiovascular system, remember the blood, it carries the oxygen, but it also carries the waste, such as a person who's had like too much potassium. And so it's going to help remove those wastes by circulating them through the bloodstream. And hopefully they're going to be metabolized by the liver or excreted by the kidneys. So we need all these organs to work properly. And you all, Natasha, Nikisha, Vilma, Nilly, and Jasmine, Chris, it was so many of you all. I've reached the end, and I will see you all over the weekend. I will continue to pray for you all. Good luck on your test, and I hope this encouraged you to at least try to think about going to nursing school. You're smart enough. You have what it takes. And I'll see you all in the next video. Bye, everybody.